You're watching CTOM TV. Knowledge is power.
Biopsy is what would happen. We see something on a CT or an MRI, and your GP still, usually we are not sent to an oncologist until this process is kind of run through and you've had a biopsy of some sort. The biopsy is trying to determine, taking a sample, whether with a needle or scalpel or other approaches, to find out if in fact this is cancerous. And the biopsy itself then gets sent, hang on a second, where did my thingy go? Gets sent to a pathologist. Usually there's a pathology lab associated with the hospital where your procedure would be conducted, and that's where your tissue gets sent. And the pathologist assesses your tissue for certain indicators of malignancy. Really, that's kind of basic pathology. They're staining your tissue sample to see if it turns certain colors to identify malignancy, at which point you would be diagnosed with cancer, and your GP would receive this information and then refer you on to the cancer clinic in your region. So that's kind of standard diagnostics, CT and or MRI with a follow-up biopsy. And then the pathologist determines, yes, it is cancer. And now you're in the queue to see an oncologist. And that process, as you're probably well aware, depending on your doctor and the time and the system and all this stuff, it can easily take a couple of years depending on your symptoms, but commonly at 3 to 6 months would be a minimum. Would you say, Alex, in our
Yeah, it could be more
experience?
than that. I've seen patients wait, a year.
Mhm.
in
Yeah, it's a
Canada.
long time. So when you can arrange out of it, yes, you'd have to pay out of your own pocket, but you can get a PET CT scan. It costs about $2,000. It takes about a week to coordinate privately, and you'd know with absolute certainty, yes or no, it is cancer, where it is, which tumors are most aggressive. So that's a critical piece of diagnosing cancer effectively. And we'll come in a little while when we talk about monitoring, we'll come back to talking about PET CT as well.
Thank you for watching CTOM TV. Subscribe below and stay informed.